It's a team approach. There's not one person that can improve care transition or the rate of readmission. It has to be all of the teams working together with nursing and therapy and dietary services and social work and our patient and our physicians. I mean, they all have to come together, understand the goal, and not lose focus to continue to help that patient and be ready to transition them in the next phase when they go home with home health services and back to the care of their primary care physician.
We have 2 nurses that are clinical nurse leader role, and they're instrumental in the success of our program.
We help with the collaborative care of patients. We are lateral integrators of care with other departments and services. As opposed to a staff nurse, they don't have that time, where the clinical nurse leaders do have that time to spend with patients and those special populations.
With our phone call follow-up, we'll call the skilled facilities.
Hi, can I talk to the nurses station that has Janice McNeil, please?
Hi, this is Amy.
The nurse at the hospital called our nurse here and told them she was coming to us because she had had congestive heart failure and that they needed to weigh her daily, what her weight was prior to coming to us. They reviewed the medications that she was on, including her diuretic, so that they would know exactly what dose she was to come to us on. And then they reviewed just general things like how she was getting around and what kinds of things she was doing as far as ambulation and toileting.
She's currently on 2 liters of oxygen, and how have her SATs been?
Is there any follow-up appointments needed with the cardiologist or the congestive heart failure clinic?
Nurse-to-nurse communication is vital. Just like we talk about a care transition from the hospital to the skilled nursing to the home care. We have care transitions every shift.
Every night, basically, it seemed as if whoever was on day shift, they would talk to the individuals that were coming on night shift. And they would give them an update on exactly what happened during the course of the day. So it was like everybody knew what was happening and everybody communicated with each other.
We struggle, like many communities, with the idea that each of our partners has a different electronic medical record or no electronic medical record. So we developed what's called a Regional Health Information Exchange, or RIO. This allows us to have a basis for communicating key information regardless of what electronic medical record each office, clinic, facility uses, including our skilled nursing facilities and home health care.
What information do you need going out of our hospital that you don't get? What do we need to have a good transition for the patient?
We found out the problem was we had way too many lists of medications. When we worked with Creighton on the transfer form, we found out we were getting all kinds of information. They found out we were getting all kinds of information we didn't need that they thought we needed. But here's what we really need to make the transition smooth.
We coordinate their transition with the hospital to make sure that they've had their medication, and if another important medication is going to be due soon after their arrival here, we want to have that medication available, either to have that sent with them from the hospital, or we do have medications on hand here.
I don't know if I should thank you for that or not. Thank you.
You're welcome.
What happened when you fell?
You know what? I tripped over my feet.
We try to see the same patient with the same therapist from admission all the way through to discharge. We feel like when we're able to see the same patient day in and day out, we're able to pick up on the subtle changes that the patient has and really get to know the patient and thereby reduce kind of the handoff and transitions of care. All of our patients that have congestive heart failure get educated on those heart failure zones and are flagged with the hearts on their charts and the hearts on their dry erase boards in their room, so that all team members are aware that this patient has congestive heart failure. What zone are you today?
Well, I have more shortness I haven't gained any weight.
So
I feel tired.
okay. So when we have changes in a patient's status, we communicate first of all with the nursing team, and we utilize a modified SBAR form, and SBAR stands for Situation, Background, Assessment, and Recommendation. Can I bother you for a minute? Yeah, sure. I was working with Janice this morning, and she's been here a couple of days, and I had a couple of concerns. We give the nurse kind of the situation, what we were doing with the patient, the background on the patient, so that we know a patient has congestive heart failure, and then what the assessment is. How has their heart rate changed at rest and with activity from yesterday to today, and what we want the nurse to do about it.
I'll go in and see her, and I can give the doctor a call and see if they want to do anything different.
That would be great. All right. Thanks, Amy.
You're welcome. Hi, this is Amy at Hillcrest. I'm taking care of a patient of Dr. Fox.
Communication is key, otherwise somebody falls between the cracks, and before you know it, they're in trouble. And that's when you can't really treat them in our facility anymore. You have to catch it early so that you can do the things we can do here.
She does have a little bit of swelling in her legs that we've noticed. That's new within the last couple days.
Some of the biggest challenges that we have faced is a physician buying into the fact that we can treat that patient in our facility, that they don't have to go out to the emergency room.
I started working with our doctors and started reducing the amount of physicians that were in their on-call group and limiting those physicians to the doctors who come in here, who work with our team, who know our nurses and our patients. And we saw that to be very effective in reducing our readmissions.
If our staff feels empowered, they feel like they can do what they need to do, that they have the ability to recommend to a physician that here's what we could do to keep this patient here, their satisfaction as a nurse and as an employee in our facility just goes through the roof.
We just know that the team's in place and they're doing a great job, and that's what the beauty of this is just to see people pulling together. Everybody's knowing the goal, they're working towards it, and the patients know it too.
They've done a pretty good job with me. And I've been there quite a bit, so I'm probably a good judge.